We're talking with Dr. Kyle Pearson, board-certified foot and ankle surgeon with Morris Hospital orthopedic specialists. Dr. Pearson treats adults and children with common to advanced foot and ankle problems using both non-surgical and surgical treatment procedures. The doctor sees patients in the Morris, Joliet, and Ottawa offices. You can make an appointment with Dr. Pearson by calling 815-942-4875. Happy to have you as we want to talk about ankles and all the issues that can be faced by folks with the foot, and it's an area that kind of sees a lot of impact when you're out running around, especially this time of year. The athlete hitting the tennis courts, or maybe out for a jog, or just everyday life. You're constantly walking, putting pressure on that ankle. So we're kind of focusing on ankle arthritis, ankle replacement. What are some of the basics, I guess, that we kind of need to know about when it comes to some of this?
Yeah, good points on that too. A lot of times people don't realize how important their foot and ankle is in helping them stay active and mobile until they have a problem with it. And one of the nice things that kind of with technology advancements and our training has advanced as well is providing different treatment options for those that develop arthritis within their ankle. So it's been nice to be able to offer options and with the newer technology, like I mentioned, with total ankle replacements for those individuals with end-stage arthritis within the ankle that have gone through the traditional non-surgical treatment. Instead of an ankle fusion kind of being the gold standard now, we've kind of been able to move towards ankle replacement, where people can keep their range of motion and hopefully allow them to stay active, and it helps with the joints surrounding the ankle as well.
So when we talk ankle arthritis, how advanced is a situation where it becomes arthritic? What are some of the things folks should be looking for as possible warning signs?
Yeah, good question. Usually arthritis can form a couple different reasons. One reason is after an injury. Say an individual has history of multiple ankle sprains or an ankle fracture or injury, to the ankle joint itself. You can develop over time some arthritis in the ankle. The other ways you can develop arthritis in the ankle is through other conditions such as rheumatoid arthritis or gout. That affects the joint itself. And then the final way is just good old-fashioned wear and tear. Just over time, the cartilage, or as we kind of call it, the brake pad in the ankle can wear out. And so the good thing is there's a lot of great non-surgical stuff that we can do in the office to get people, staying active and on their feet. But there's also, now even better options surgically that were previously not available for patients.
So if you're experiencing some pain in the ankle area, maybe you actually did something specific that caused that pain, or as you mentioned, the wear and tear, maybe over time it just starts to feel sore or what have you, what should you be looking for, and when would it be a case where you have it looked at?
Yeah, good question. So I think, if it gets to the point where, it's hurting on a more routine basis, and simple things such as ice and rest and good old-fashioned ibuprofen or Advil and anti-inflammatory isn't helping it much anymore. That's the time, to come in and get it checked out and see if there's different options that we can do non-surgically first to help you out. And then if those don't provide the relief that we're looking for, then we can always move forward with other options.
So if you're at a case where you're spraining your ankle or doing something like that, obviously you want to get that checked out, but I guess anytime you feel something that just doesn't quite feel right, you mentioned some of the at-home remedies, the ice and that type of thing, but if it persists for any length of time, definitely get it checked out.
Yeah, absolutely. And so just like you mentioned before, ankle sprain is a very common thing we see as well. And some people say, oh, it's just a sprain. But what studies and stuff have shown that, to be a little bit more proactive with those, if you're having trouble walking, on the foot or ankle right after the injury or a day or two after, and you've tried elevating, you've tried, wrapping it with an A-strap, you've tried the anti-inflammatory, and you're still having problems, it's not something just to walk off. There are some simple things like ankle braces or a boot or even formal therapy that have been shown to really prevent, recurring problems in the ankle that can lead to an arthritis situation down the road. So I think, more so than not, after the simple things are tried, being proactive and getting in to have us help you get on a good track by evidence-based medicine really has been shown to make a big difference in these situations.
Great advice, Doctor. We appreciate your time. Thanks for joining us, and we'll look forward to another chat down the road.
Absolutely. Thank you for having me.
Dr. Pearson's special interests include foot and ankle injuries, fractures, arthritic joint conditions, bunions, hammer toe deformities, heel pain, plantar fasciitis, diabetic foot and ankle conditions, wound care, soft tissue tumors, and more. Advanced training in foot and ankle surgery includes foot and ankle reconstruction, midfoot and hindfoot fusion, ankle arthroscopy, total ankle replacement, and more. If you want to find out more, go to morsehospital.org, click on Orthopedics and Sports Medicine. And again, you can make an appointment with Dr. Pearson by calling 815-942-4875.